Even some people who do put aside and prioritize sleep have difficulty sleeping, either because of insomnia or because of a variety of specific sleep disorders. And there are a variety of causes for inadequate sleep. One of them is just not putting enough time aside for sleep. And then there are some external demands such as shift work, which also interfere with our ability to sleep at night. Some of the common sleep disorders that we see, probably the most common, is insomnia. People have difficulty initiating and maintaining sleep. And that's associated with daytime impairment, difficulty concentrating, daytime fatigue, a variety of other somatic complaints can accompany that. There are a variety of causes for insomnia. A lot of times it's stress, it's conditioned insomnia where they just simply learn not to sleep. And then there are a variety of very significant sleep disorders from a medical aspect. Sleep apnea is probably the most common condition that we see in the lab. Sleep apnea presents with nighttime symptoms such as snoring, awakening, gasping, sometimes frequent urination at night, and daytime symptoms such as fatigue, difficulty concentrating, daytime sleepiness. And then there are disorders such as periodic limb movements where people will jerk their legs in their sleep, and a variety of behavioral abnormalities such as sleepwalking or REM sleep behavior disorder where people get up and act out their dreams. The general consequences of inadequate sleep are having poor quality of life. People just don't feel as good if they don't get a good night's sleep. Our ability to learn is impaired, both because we're sleeping in class as a student and because we are unable to consolidate memories properly. Your judgment is impaired. You don't make good decisions if you're sleep deprived. And there's good evidence that you take increased risks. And they're not good risks, they're risks that end in bad consequences. And then there are a variety of health consequences from any type of inadequate sleep. Things like increased body weight, increased inflammatory markers, there's a decreased immunity, there's increased cardiovascular risk, and even an increased risk of sudden death. Certain cancers have been linked to inadequate sleep. As far as who should really be concerned, a person who has excessive sleepiness that doesn't respond to simple measures. If you have difficulty initiating and maintaining sleep that leads to daytime consequences. If you have symptoms of sleep apnea such as snoring, gasping for air, daytime sleepiness, then you really want to have that further evaluated. I think the most important thing is that a good night's sleep is really essential to feeling at your best in the daytime. And if you have a disorder which may be interfering with your ability to get a good night's sleep, then going to a sleep lab and having it adequately diagnosed can be life transforming. It really can make a big difference.